Hello everyone. Now we will start with our new chapter from Pharmaceutics-II, that is sterile dosage form. Already we have covered the different types of dosage forms like powders, then all types of monophasic liquid dosage form, then biphasic liquid dosage forms, then semi-solid dosage forms, and the dental and cosmetic preparation. So now we will start with a new chapter with a new type of dosage forms, that is sterile dosage forms. So first we will see the concept of sterile dosage form. So sterile dosage form refers to a product of a general group of pharmaceuticals having in common the characteristic of sterility, that is free from living microorganisms. Okay, first I will explain you what is meant by sterile. Anything which is free from all types of microorganism, either they are pathogenic microorganisms or the non-pathogenic microorganisms. Also, it is free from all types of pyrogens, and that particular product is known as sterile. Okay, the formulation which is completely free from all types of microorganism as well as free from pyrogens is known as sterile formulation. Okay, so there are various types of sterile formulations, okay, or the different dosage form which comes under the sterile formulation. These are injections, then radiopharmaceuticals, sterile suspensions, ophthalmic solutions, suspension, and the ointments. Okay, all the types of ophthalmic formulations are sterile formulations. Again, solution for the irrigation, then diagnostic agents, then peritoneal dialysis solutions, infusion fluids, and the sterile solids. Okay, first I have told you that what is meant by sterile, the formulations which are completely free from all types of microorganisms, all types of foreign particles, and all types of pyrogens. They are known as sterile formulation. Again, the different formulation which are come under the sterile products are injections. Okay, all injections are sterile formulations. Again, the radiopharmaceuticals. Radiopharmaceutical means what? These are the radioactive isotopes which are used to diagnose the dysfunction of the body or dysfunctioning of the body tissues. Okay, so different radiopharmaceuticals are calcium 47, then carbon 11, carbon 14, cobalt 57, iodine 123, iodine 125, and iodine 131. Okay, so there are a lot of radiopharmaceuticals which are used to diagnose the dysfunctioning of the body tissues. Okay, and these all the radiopharmaceuticals are parenteral formulation, or these are injected in the body. Okay, so the product which are come in direct contact with the blood, or which are injected or administered in the blood circulation directly, these all products should be sterile. Okay, and radiopharmaceuticals are generally injected in the body, so they should be sterile. The next are the sterile suspensions. Okay, the drugs which are insoluble in water or which get degraded in contact when they contact with the water, they should be supplied as a dried suspensions. Okay, or in some cases the suspensions are made also and that are injected in the body. Again, all the ophthalmic formulations like eye drops, eye lotions, eye ointments, they should be sterile. Okay. The ophthalmic formulations are instilled in the eyes. Okay. So if they are non-sterile, जर का ते sterile नसतील तर काय होणार? They may cause irritation to the eyes or they may cause infection to the eyes. Okay. And eye is a delicate organ, so all the ophthalmic formulations should be sterile, that is they are free from all types of microorganisms as well as pyrogens. Then the solution for the irrigation. Okay, so different solutions are used, or different non-pyrogenic isotonic solutions are used to clean or to wash the different body cavities. Okay, for example is the 0.9% NaCl solution, which is isotonic with the body fluids, is used as an irrigation solution and it is given by the parenteral route. So it come in direct contact with the blood circulation. So all the irrigation solutions should be sterile. Again, different diagnostic agents. Okay, different diagnostic agents which are used to diagnose the dysfunctioning of body, they are also injected in the body, so they should be sterile. Again, peritoneal dialysis solutions. Okay, the different dialysis solutions are used to remove the excess of fluid, again to correct the electrolyte balance, electrolyte imbalances, or to remove the toxins in case of kidney failure. So they are also injected or given by the parenteral route, so they should be sterile. Again, different infusion fluids and the sterile solid products. Okay, so all these products should be sterile, that is जे काही इंजेक्शन आहेत किंवा रेडिओ फार्मास्युटिकल स्टराईल सस्पेन्शन असतील किंवा ऑप्थॅल्मिक फॉर्म्युलेशन असतील, आय ड्रॉप, आय लोशन्स, आय ऑइंटमेंट्स. ओके, अगेन द इरिगेशन सोल्युशन्स, then peritoneal dialysis solution, infusion fluids, all these products should be sterile because they are injected or administered in the direct blood circulation, so they should be in sterile form. So ते काय असले पाहिजे, स्टराईलच असले पाहिजेत, दॅट इज ते पूर्णपणे सर्व टाईपच्या मायक्रो ऑर्गॅनिझमपासून फ्री असले पाहिजेत. Again, they should be free from all types of pyrogens. Okay, and again pyrogens, these are the metabolic products of the microorganisms. If they are by mistakenly administered, then they may cause rise in the body temperature. So all sterile formulations should be free from pyrogen also. Okay, so this is the concept of sterile product. Then in this chapter we are focusing on the parenteral preparations. Okay, so we will see what is meant by parenteral preparations. So mainly there are two types of route of administration of particular dosage form, that is enteral route and the parenteral route. Enteral route means which is given by oral route. Okay, and parenteral route means, para means outside and enteron means the intestine. The formulations or dosage form which are given beyond the intestine or out of the intestine, they are known as parenteral preparations. Okay, जे फॉर्म्युलेशन आपल्या इंटेस्टाईनच्या कॉन्टॅक्टमध्ये येत नाहीत किंवा ते इंटेस्टाईनच्या बाहेर बॉडीमध्ये ॲडमिनिस्टर केले जातात किंवा इंजेक्ट केले जातात, त्यांना आपण काय म्हणतो, पॅरेंटल प्रिपरेशन्स. ओके, so we will see the definition of parenteral preparations. Parenteral products are considered to be the sterile solutions suspension, or emulsions that are administered by hypodermic injection, either in the form in which they are supplied or after the addition of suitable solvent or suspending agent. Okay, so what is meant by parenteral preparations? Parenteral products are considered to be sterile solutions. Okay, they are sterile. First thing is they are sterile. Okay, then either they are sterile solutions, suspension, or emulsion. They may be available as a solution, suspension, or emulsion, and which are administered by the hypodermic injection. Okay, so what is meant by hypodermic injection? Hypodermic injection or hypodermic needles, these are the category of medical tools which are enter the skin and which is a sharp or very thin and hollow tube with a sharp tip. Okay, so it is commonly used with a syringe, that is hand operated device with a plunger to inject the substances into the body or to extract the fluids from the body. Okay, so what is meant by hypodermic injection? It is a type of needle, okay, which is thin and which is hollow from inside and which has a sharp tip, and generally it is attached with a plunger or syringe, we can say it as a syringe, and it is used to inject the substances into the body. Okay, and they are injected either in the form of they are supplied in the form of solution, or they are after the addition of suitable solvent or a suspending agent. Okay, either the रेडीमेड सोल्युशन फॉर्ममध्ये असू शकतात किंवा ड्राईड फॉर्ममध्ये सप्लाय केले जातात आणि बिफोर ॲडमिनिस्ट्रेशन दे आर रिकॉन्स्टिट्यूटेड विथ अ स्टराईल वॉटर फॉर इंजेक्शन अँड आफ्टर दॅट दे आर इंजेक्टेड. Okay, so what is meant by parenteral preparation? First thing, these are the sterile. Okay, then either they are solution, suspension, or emulsion. Again, they are injected with a hypodermic needle and they are supplied in the form of solution or administered after the addition of suitable solvent and the suspending agent. Okay, जे काही इंजेक्शन्स दिले जातात, ओके, दे आर नोन ॲज पॅरेंटल प्रिपरेशन. अगेन जे काही इंजेक्शन्स आहेत ते आयदर सोल्युशन फॉर्ममध्ये असू शकतात. जर का ड्रग इन्सोल्युबल असेल सॉल्वंटमध्ये तर ते सोल्युशन फॉर्ममध्ये आपण करू शकतो, किंवा ड्रग इन्सोल्युबल असेल तर त्यापासून आपण सस्पेन्शन किंवा ड्राईड सस्पेन्शन फॉर्ममध्ये त्यांना आपण सप्लाय करू शकतो, किंवा जर का ते ऑइली असेल किंवा ऑइल सोल्युबल ड्रग असेल तर इमल्शन फॉर्ममध्ये आपण सस्पेन्शन फॉर्म्युलेट करू शकतो. ओके, इमल्शन फॉर्ममध्ये आपण इंजेक्शन्स फॉर्म्युलेट करू शकतो. सो हे इंजेक्शन जनरली हायपोडर्मिक निडल्सच्या साहाय्याने दिले जातात. ओके, तुम्ही सगळ्यांनी निडल सिरिंज पाहिली आहे, तर विथ द हेल्प ऑफ दॅट हायपोडर्मिक निडल दिस फॉर्म्युलेशन्स आर इंजेक्टेड बाय डिफरंट रूट्स. ओके, अगेन वी विल सी द डिफरंट रूट्स ऑफ पॅरेंटल ॲडमिनिस्ट्रेशन. Okay, so this is the definition of parenteral preparation. So examples of parenteral preparations are transfusion fluids and the injection are the parenteral preparation. Okay, so different injections and the transfusion fluids are come under the category of parenteral preparation because they are given beyond the intestine, okay, or the route other than intestine. ते कोणतेही आपल्या डायजेस्टिव्ह सिस्टीमच्या कॉन्टॅक्टमध्ये ते ड्रग किंवा फॉर्म्युलेशन येत नाही, ते डिरेक्टली ब्लड सर्क्युलेशनमध्ये इंजेक्ट केलं जातं. ओके, सो ट्रान्सफ्युजन फ्लुइड्स अँड इंजेक्शन ऑल आर द पॅरेंटल प्रिपरेशन. सो व्हॉट इज मीन बाय ट्रान्सफ्युजन फ्लुइड्स? So these are the blood or blood products which are given in the systemic circulation by intravenous route. Different blood components like packed RBCs, platelets, or isotonic fluids. These are transfused or administered in the blood circulation by the intravenous route, so they should be sterile, and they come in the category of parenteral preparations. Okay. The next one is which are the different advantages of parenteral preparations. Okay. What should be possible advantages of parenteral preparation? First thing is they gives a quick onset of action. Okay, all of you know what is meant by onset of action. Okay, when particular drug is given for a particular disease, after that it is get dissolved in the body fluids, and it reaches to the systemic circulation to the site of action, and after that it gives their suitable therapeutic action. Okay, so it is known as onset of action. In case of parenteral, these are administered directly into the blood circulation. Okay, so that the drug get directly transferred to the site of action, so that it gives a quick onset of action. Here it does not require the time for its disintegration, dissolution or absorption, so that the drug which is administered through the parenteral route gives the quick onset of action, because they reaches to the site of action immediately through the blood circulation. Then next is these are suitable for the drug which are not administered by the oral route. Okay, when oral route is not convenient, in case of unconscious patient, in case of childs or the old peoples, okay, or the older patients, in that case, or in case of certain diseases of the mouth, we cannot use the mouth as a route of administration, or the patient which are in coma. Okay, for that patient the parenteral route is mostly useful. So it is useful for the unoperative, nauseous or the unconscious patients which cannot take the drugs or formulation by the oral route. In that case, mostly the parenteral route is preferred. Again, it is useful for the emergency situation. Okay, as the drug which is administered to the parenteral route gives a quick onset of action, so this route is preferred in the emergency situation, so that patient get immediate relief from a particular disease condition. Again, the patient who are vomiting, unconscious, which cannot take drug by the oral route, in such cases the drug is administered by this route. Again, the duration of action can be prolonged by the modifying formulation. Okay, we can achieve the prolonged effect of drug by doing certain modification in the parenteral formulations. That is, we can make them as a depot formulation like suspensions, then liposomes, hydrogels, or the microsphere, or the lipophilic solutions. Okay, so by doing certain modifications or formulating as a depot formulations, we can achieve a prolonged effect or prolonged action of a particular drug to minimize the frequency of dosing. Okay, again, means of correcting the serious substances of fluids and electrolyte balance. Okay, so certain transfusion fluids or the nutritive like glucose or electrolytes, such as sodium chloride can be given by this route, okay, to achieve or to correct the serious disturbances of body fluids. Okay. So these are the certain advantages of the parenteral preparations. Then next are the disadvantages. Okay, along with advantages, it has some disadvantages also. First thing, only the trained personnel is required. Only the trained persons are required to administer the drugs. Okay, the patient himself cannot take these parenteral preparations. Okay, so the trained persons are required to administer this type of drugs by the parenteral routes. Again, the injection can cause the pain at the site of injection. Okay. It causes the paining at the site of injection. Also, it is difficult to reverse the physiologic effect of drugs. In case of toxic effect or in case of excessive dose, we cannot reverse the physiologic effect of the drug, or we cannot remove the drug. Again, the sensitivity or allergic reaction at the site of injection, it leads to the sensitivity or allergic reactions or paining at the site of injection. Also, it requires the strict control of sterility and non-pyrogenicity than other formulation. Okay, as the parenteral preparations are the sterile formulation, the sterility is maintained throughout the formulation. Also, sterility is required to be maintained during the administration of drug. Again, it is a more expensive and costly to produce. Okay, the production cost is greater as compared to other formulations because it requires a strict control over the sterility or aseptic condition are required to be maintained during the formulation or production of these preparations. So it requires the more cost or they are expensive to produce. So we've seen the definition of parenterals and the advantages and disadvantages of the parenteral formulations. Then next we will see which are the different routes of administration of parenteral products. These injections or transfusion fluids, how they are administered, or which are the different routes are used to administer the injections. Okay, so there are several routes to administer the injection and transfusion fluids based on the site of release, okay, or site of administration. So these routes are intramuscular, intravenous, intraarterial, intracardiac, intrathecal, intraosseous, that is into bone marrow, intrapleural, intraperitoneal, intraarticular, intradermal, that is intracutaneous, then subcutaneous route, then intracisternal, peridural, and the intracerebral. Okay, depending on the site of injection, there are different routes of administration of these parenteral products. So we will see in detail one by one. First route is the subcutaneous route. First route is the subcutaneous route or the hypodermis. All of you know the different layers of skin. The outermost layer is known as epidermis, then middle layer is the dermis, and innermost layer is the hypodermis, or it is a subcutaneous layer. So these injections are made under the skin into the subcutaneous tissues, and this subcutaneous route might be used for the arm, forearm, thigh, and the subscapular space. Okay, so subcutaneous injections are given below the skin or under the skin in the subcutaneous tissues, and they are given either on the arm, forearm or the thigh, and generally the volume of this injection is ranges from 1 ml to 2 ml. So insoluble suspensions like insulin and the solids might be applied by this route. Okay, so insulin injections or some solid drugs or suspensions are injected at the subcutaneous route. So it has some advantages like there is a absorption is slow and constant. Also it is hygienic. Okay, when the drug is given by subcutaneous route, the absorption of drug is slow and it is constant. But it has some disadvantages like it might leads to abscess formation. Okay, the tissue gets swell or they form the abscesses at the site of injection. Again, the absorption is limited by the blood flow. At the subcutaneous layer, when the drug is administered at the subcutaneous layer, the absorption is limited. Okay, so the drugs like adrenaline or the insulin injections are given in this route. The next one is the intramuscular route. These injections are given in the muscular tissues, that is muscles of the shoulder, thigh or buttock are usually selected, and its volume ranges from 2 to 3 ml. And volume should not exceed the 4 ml. Again, it has some advantages like absorption is rapid than subcutaneous route. Okay, as compared to subcutaneous route, when injection is given to intramuscular route, the absorption is faster. Then the oily preparations can be used. Again, the irritative substances might be given. Okay, the oily or irritative substances may be given by this muscular route. Again, slow releasing drugs can be given by this route. Okay, so it has some advantages over the subcutaneous route, like it gives the rapid absorption. Also, the oily, irritative and the slow releasing drugs can be given by this route. But it has some disadvantages like when using this route, it might cause the nerve or vein damage. Okay, it may causes damage to the nerve or vein also, which may lead to the serious consequences. So care must be taken when giving the injection by intramuscular routes. The next one is the intravenous route. So these injections are made into a vein. Okay, therefore introduced directly into the bloodstream. The injection are given in the veins. Okay, so intravenous injection has some advantages like there is a immediate action takes place. Okay, as it is given directly in the vein or directly in the blood circulation, it gives the immediate action of drug. Again, this route is prepared in emergency situation. Also, it is preferred for the unconscious patient. Again, the large volume of fluids might be injected by this route. Then, diluted irritant might be injected. Here the absorption of drug is not required because drug directly goes in the blood circulation. Again, no first pass effect takes place. Okay, drug is not reaches to the liver. So the metabolism or first pass metabolism of the drug is not takes place. Also the blood plasma or fluids might be injected. Okay, so different blood plasma transfusion fluids can be injected by the intravenous route. So it is mostly preferred route, but it has some disadvantages also. First thing, there is a no retreat. We cannot remove the excessive or the toxic doses. Again, this method is more risky. Okay, the introduction or administration by this route is slightly difficult and it is risky also. The sepsis or infection might occur. Okay, if the care is not taken during administration, it may lead to the sepsis or infection. Again, it may causes phlebitis, that is inflammation of the blood vessel may occur. Again, infiltration of surrounding tissue might result. Okay, so it requires the isotonic injections or isotonic transfusion fluids only, otherwise it may lead to the infiltration of the surrounding tissues. Again, this method is not suitable for oily preparations. Oily preparations are not administered by the intravenous route. Again, this method is not suitable for the insoluble preparations. Okay, insoluble preparations like suspension or emulsion that are not administered by the intravenous route. The next one is the intradermal route. Intradermal route, or it is also known as the intracutaneous route, and in this route the injections are given between the dermis and epidermis. Okay, in between the layer of dermis and epidermis these injections are given, or this route is mostly used for the diagnostic purposes. Okay, to diagnose the different diseases. This route is used. Okay, so the Sheik test for the diphtheria, again the Dick test for the scarlet fever, again some vaccine which are vaccines like DBT, BCG and polio or the sensitivity test for the penicillin is done at this route. Okay, or the solutions or vaccine which are used, or the test solution which are used for these different tests for different diseases are injected at this intradermal route, that is between the dermis and epidermis. Okay, so these are the routes of the parenteral administration. See here the different layers of skin, that is epidermis, dermis, subcutaneous tissue and the muscle. Okay, so intramuscular injections are given in the muscles. When the injections are given at the angle of 90 degree to the skin, it reaches to the muscle. Okay, किंवा जेव्हा आपल्याला इंट्रामस्क्युलर इंजेक्शन द्यायचे असेल त्यावेळेला जे काही इंजेक्शन्स आहेत ते आपल्याला स्किनमध्ये 90 डिग्रीला परपेंडिक्युलर ते आपल्याला इंजेक्ट करायचे आहेत. As the route gate changes, the angle of injection gate also changes. जर का आपल्याला सबक्युटॅनियस रूटमध्ये इंजेक्शन द्यायचं असेल तर स्किनला आपल्याला 45 डिग्री अँगलमध्ये इंजेक्शन इन्सर्ट करायचं आहे. अगेन फॉर इंट्रावेनस इंजेक्शन इज गिवन ॲट द अँगल ऑफ 25 डिग्री. फॉर द इंट्राडर्मल द इंजेक्शन्स आर गिवन ॲट द अँगल ऑफ 10 to 15 degrees. So these are the different positions for injecting the injection at the different routes. For intramuscular it is 90 degree. For subcutaneous it is 45 degree, for intravenous it is 25, for intradermal it is 10 to 15 degrees. Okay. Then next route is the intra-arterial route. Okay, as similar to the intravenous route, these injections are given in the arteries and which are occasionally used for the immediate effect in the peripheral areas. Okay, the injections are given directly in the arteries. So in case of chemotherapy, for the malignant tumors means which can spread from one organ to the other organ. So in the case of chemotherapy for the treatment of malignant tumor and in the angiography, the intra-arterial route is preferred. The next are the intracardiac route. These are given into the heart muscle or ventricle in an emergency. Okay, so in case of cardiac arrest, the injections are given in the heart muscle or in the ventricles. The next one is the intrathecal. Intrathecal route means it involves the subarachnoid space. All of you know the subarachnoid space that surround the spinal cord. Okay, so in case of spinal anesthesia, the injections are given by the intrathecal route. Intrathecal means in the subarachnoid space which surrounds the spinal cord. The space around the spinal cord is known as subarachnoid space. In that space, the injections are injected. Okay. The next one is the intra-articular route. These injections are given in the liquid that lubricate the articulating ends of the bone in the joint. Okay. Intra-articular injections are given at the joints of bones. Some corticosteroid drugs are administered by the intra-articular route in the acute arthritis treatment. The next one is the intraperitoneal route. These injections are injected or given in the peritoneum or the abdominal cavity for the peritoneal dialysis. All of you know the peritoneum or abdominal cavity. The next one is the intrapleural route. Okay, so penicillin may be injected in case of lung emphysema by the intrapleural route. Intrapleural means the pleural cavity. Okay, that is cavity which surrounds the lungs or the space around the lungs is known as pleural cavity. In that cavity, the intrapleural injections are given. The next one is the injection into the bone marrow. The injections are directly given in the bone marrow for some diagnostic purposes or some therapeutic purposes. Okay, either to diagnose the functioning of bone marrow or to administer some drugs in the bone marrow. The drugs are directly injected in the bone marrow. The next one is the intracisternal. These are given in the different vertebrae, like these are given in between the first and second cervical vertebrae, and this route is used to withdraw the cerebrospinal fluid for the diagnostic purpose. Okay, all of you know the vertebrae. Okay, so there are 7 number of cervical vertebrae. So in the intracisternal injections or this route, the injections are given between the first and second cervical vertebrae. So to remove the cerebrospinal fluid for the diagnostic purpose, this route is preferred. The next one is the peridural route. So these are given between the dura mater and the inner aspect of the vertebra. So this route is used for even the spinal anesthesia in special cases. Peridural or the epidural, that is space around the spinal cord or the outermost part of the spinal cord. In that case, at that space, the peridural injections are given for the spinal anesthesia. The next one is the intracerebral route. These injections are directly given in the cerebrum of the brain. Okay, so these are the different routes of administration for the parenteral preparation, or the parenteral preparations can be given by all these routes. So you should know the site of this route, okay, where the subcutaneous injections are given, where the intravenous, intramuscular injections are given, okay, where the intrapleural, epidural, intrathecal injections are given. Okay, depending on the site of release or site of administration, there are several routes of administering the parenteral preparation, or injections can be given at the different places. And you should know the what type of preparations are given, or what is the use of this route, okay, either for the diagnostic or therapeutic purpose. Okay, so now we will stop here. From next lecture we will see which are the different types of parenteral preparations. Again we will see the general requirements for the parenteral dosage forms. So sterile formulation means, so once we will revise this, sterile formulation means the formulations which are completely free from all types of microorganisms like pathogenic or non-pathogenic microorganisms, and the pyrogens are known as sterile preparations. So there are number of sterile preparations like parenteral, transfusion fluids, ophthalmic preparations, then dialysis fluids, irrigation solutions, infusion fluids. Okay, so now in this chapter we are focusing on the parenteral preparations which are given by the parenteral route. Parenteral route means beyond the intestine. So we have seen the different routes of parenteral administration. There are number of routes by which we can administer or inject the parenteral preparations. Yes, so now we will stop here, and thank you for your attention. For any query, please ask to me. You have to remember all the types of routes, okay, their names and their site. ॲक्च्युली इंट्रामस्क्युलर म्हणजे ते कोणत्या ठिकाणी दिले जातात रूट्स, ओके, किंवा इंजेक्शन्स. इंट्राव्हेनस म्हणजे कोणत्या ठिकाणी दिले जातात. इंट्रा आर्टिरियल म्हणजे काय, इंट्रा कार्डियक म्हणजे काय. ओके, तर हे तुम्हाला रूटचे मिनिंग माहिती असले पाहिजे की ॲक्च्युली कोणत्या साईटमध्ये ते ड्रग इंजेक्ट केलं जातं. आणि त्याचा यूज काय आहे. ओके, सो थँक्यू फॉर युअर अटेन्शन.